today by retired Calgary firefighter Gord Caldwell in Okotoks and by our leader, Rachel Notley. Gord is one of the tens of thousands of Albertans who were harmed by the decisions of the UCP government, reaching back even before the pandemic. In their very first budget, the UCP decided to kick the dependents of seniors off their drug coverage plan. Overnight, family members had their benefits eliminated and were forced to scramble to ensure that they could afford the prescriptions they rely on. Now we know the full scale of this policy decision on Albertans. According to government documents published last week, the number of Albertans enrolled on this plan dropped in 2020 by 40,126. One of those households was Gord Caldwell and his wife, Marianne. And I'll invite him to tell his story now. Gord?
Gord, I believe you're still muted. You just dropped off. I have no idea where you went.
Looks like we just lost Gord for a moment there, so if you can stand by for a moment, we'll get him back on the Zoom. I think we've got him back. One moment. We can see you, Gord. We can't quite hear you yet.
Hello, can you hear me now?
Excellent, yes.
I apologize. I have a bit of a weak internet connection out here. Ms. Notley, I apologize. I lost you there, but are you ready to go?
We sure are. Carry on.
Okay, I'm sorry. I apologize. Yeah, my name is Gord Caldwell. I'm a 31-year member of the retired member of the Calgary Fire Department. Upon our retirement, I was able to transition to a retired employee cost-shared family Blue Cross plan until I turned 65. So in July of 2019, I did turn 65, and both myself and Marianne were moved to the Alberta Seniors Blue Cross plan. And this went all very well until March of 2020. Early in 2020, we were notified of the upcoming changes to the seniors plan. I turned 65 and I was moved on to the plan, but a few months later we received notification that because my family member, my wife, was younger than 65, she would no longer be covered under the plan, and they were removing her from any coverage. This became quite stressful for us, because we were having to scramble now to find her coverage on rather short notice for her Blue Cross coverage for prescription drugs and so on. After considerable research and phone calls, we were able to find a private plan to bridge the 7 months of coverage that Marianne needed at a cost of about $200 a month until she turned 65 and could access the Alberta Seniors Blue Cross plan. We were told that the government was changing this to address allegations of fraud or abuse in the system, and this was done to make it fair and bring Alberta in line with the policies of other provinces. But I'm absolutely sure that we weren't the only seniors impacted by these changes, and that probably thousands of Albertan seniors were impacted by what we think was a rather poor and hateful decision. The policy was never mentioned in the UPC campaign and was sprung on us, I think, rather quickly. It seemed it was merely a cost-cutting measure at the expense of Albertans. In closing, I think, in my opinion, this was a poor decision and impacted families added stress and costs to their lives. We did contact the Premier and my local MLA on the issue, but I received no response, leading me to believe that I don't think the government was listening at the time. Thank you very much.
Well, thank you very much, Gord, for sharing your family story. I really appreciate it. And as Laurie said in introducing Gord, Gord's wife, Marianne, is one of 40,126 Albertans who had their drug coverage taken away by the UCP in 2020. We know this today following the release last week of the Alberta Healthcare Insurance Plan Statistical Supplement. Now, what that report will not tell us is how many other Albertans will never be enrolled from 2021 going forward who would have otherwise been eligible for these benefits. This UCP decision primarily takes drug coverage away from women and dependent grandchildren. Now, not a single member of the UCP protested when this decision was taken in the 2019 UCP budget, including Gord and Marianne's UCP MLA. Imagine a group of people sitting around a table trying to make decisions for a provincial budget. And in that particular budget, that group of people signed off on tens of millions of dollars for the War Room and for the Allen Inquiry. But at the same time, they also signed off on a decision to kick 40,126 Albertans off of their drug coverage plan. So that group of people that sat around and had that conversation, that's the United Conservative Party. And that's why Albertans simply can't trust them. But that's not all. Because while Gord and Marianne were looking for another $200 a month to cover her medical supplies, they were also paying more for car insurance, more for utilities, and more income taxes. And that is wrong. What's more, with each passing year, the UCP has also made it harder for Albertans to access the health care they need. Health care which becomes that much more necessary if you can't actually afford the prescription drugs your doctors have told you to take in order to avoid getting critically ill. There are dozens of Alberta communities where the hospital is partially closed due to staffing shortages. Ambulance response times are getting longer and longer. More than 40,000 people in Lethbridge alone can't even find a family doctor. There isn't actually a single doctor in the Bow Valley corridor now who are taking new patients. So we all know that demands on our healthcare systems increase when people can't afford the basic medications and supplies that they need to stay healthy. Given the UCP record on healthcare, this is the worst possible time for this kind of program to be in place. In 2020, 40,126 Albertans lost that coverage due to the UCP decision. Now, they made that decision long before all of their drama began with their leadership. Now, perhaps it's just who they are as a party to make that kind of decision. But since then, they've also presented 3 more budgets. That's 3 chances to undo the kinds of decisions that caused the kind of hardship that Gord and Marianne experienced. But they've chosen not to undo that decision. Today, they are too focused on themselves to notice what's happening in their own backyards and that of 40,120 Albertans. And an NDP government will always be focused on making sure that Alberta seniors and their families come first. Thank you. We're happy to take questions.
Thank you, and we'll go to questions in the room first.
Part of the reasoning that they chose to remove dependents was financial. They said, look, we can't afford everything. Has there been an accounting on exactly how much money this decision has saved on that end?
That's a really good question, and I think it was probably projected at the time, and we can get it for you. But what I would argue is this. When people can't afford their medications, what happens is they get more and more ill, and very likely they end up costing the healthcare system far more because they end up having to get more acute medical treatment as a result of not being able to afford to access their medication. As well, you have to think about the cost to Alberta families who are being hit from so many different angles with these kinds of